In Work Package 9, we aim to improve the care pathways patients need to follow in CVD care or in diabetes care. And up to now, we predominantly studied the existing care pathways in the different countries. And we saw a big variety in these structures, in these care pathways. And also a big variety in the context in which these care pathways are implemented. But we also saw that there are very similar challenges in these care pathways. So this is a very big opportunity. If we have similar challenges in different contexts and in different care pathways, we can learn from each other. We can do cross-country learning. And that's our aim. From a care pathway perspective, effective care for CVD and diabetes requires not one action, but coordinated action along a continuum of care. And such care pathways can have gaps, holes, where people get lost. For example, people are not screened or not diagnosed sufficiently. And the bigger aim of Work Package 9 is to identify these gaps and then develop and pilot interventions to address these gaps, to fill these gaps. And so the end conclusion would be, and the end goal would be, to have an integrated care pathway where nobody's lost in Europe. In Work Package 9, we aim to identify the gaps in the care pathways, and we also want to develop and pilot strategies to address these gaps. So Jacardi is not only a testing project, it's also an implementation science project. So we don't only have attention for the content of these interventions, but also to the context in which these interventions are implemented. So in an ideal state, we have a big contribution to the EC's cardiovascular health plan, in a way that we develop a set of evidence-based strategies suitable for all gaps, but also for all contexts. So that would enable the national policymakers to select an effective strategy that's adapted to their context and their gaps. That's our goal, and that's how we want to contribute.